The point of today's video isn't to scare you, but it's to make you realize the importance of investigating your tinnitus if it meets any of the criteria that I cover in today's video. So first things first, what exactly is tinnitus? Simply put, tinnitus is technically any sound that you hear in your ears or your head which is not being produced by an external sound source. In fact, it's different for everybody. In a recent poll that I put out there on YouTube asking about your personal experiences with tinnitus, there was a real mixed bag of descriptions, ranging from pulsatile, tonal, roaring, electric, buzzing, and ringing, even to boiling kettle, static sounds, warble sounds, and even the sound of people chanting in the forest. So building on this, I'm keen on gathering as much information as possible on this very subject. So I'd love to know what you, yes, you watching this video today, are experiencing as far as your tinnitus goes. Is it any of the sounds that I've just listed? Is it something completely different? Let me know in the comments beneath this video so I can tailor my future videos to you going forwards. If you've watched any of my videos before, you'll notice that I personally suffer with a high-pitched continual tinnitus, which sounds something like this. It's there 24/7, and I notice it the most if I'm lying in bed of an evening or if I'm tired, stressed, or unwell. It gives me great solace to know that tinnitus is unbelievably common, with around 50 million people experiencing some form of tinnitus. And more often than not, it's nothing that you need to worry about. There are, however, certain characteristics with any of the tinnitus sounds that I've just mentioned today that do require an immediate medical opinion. For example, if your tinnitus is only in one ear, if it's changed in nature over a very short period of time, or if it stops you from sleeping or contributes to you experiencing anxiety or depression. But saying all of that, that doesn't cover the subject of today's video. And the big question is, why is the type of tinnitus that I'm talking about today any different whatsoever? And why is it a little bit more serious than all of those that I've just listed above? Well, for starters, it's a little less common. And this is demonstrated in the poll that I presented earlier, with only 4% of you reporting it. And research out there shows that it affects around 5 million Americans. And on top of that, it isn't just annoying like a lot of the other tinnitus that I discussed today, but it could potentially be a sign of an underlying health issue. Hence, my recommendation for immediate investigation. So tell me, is this sound similar to your tinnitus? If so, it's possible that you're experiencing a form of pulsatile tinnitus. And this can come in the form of a heartbeat, swooshing, or whooshing. And this is the subject of the whole of today's video. And as I mentioned earlier, is a little bit different and potentially more serious than any other form of tinnitus. Instead of a continuous noise, you'll hear a rhythmic sound that can match your heartbeat. And unlike any other form of tinnitus, which is often a continual tone, pulsatile tinnitus beats in sync with your pulse. So what's the likely cause of your pulsatile tinnitus? Well, there are several possibilities, some being benign and others which are a little bit more serious. And we'll look into all of those causes today. Firstly, starting with one common cause of pulsatile tinnitus, which is atherosclerosis. This condition occurs when plaque, which is made up of fat, cholesterol, and other substances, builds up inside your arteries. Over time, this plaque hardens and causes narrowing and restricting blood flow. If this happens to happen in the arteries near your ears, the turbulent blood flow can create a rhythmic sound that matches your heartbeat, which you may perceive as a pulsatile tinnitus. Secondly, certain blood vessel disorders can also lead to a pulsatile tinnitus, with conditions such as aneurysms and arteriovenous malformations being key examples of this. An aneurysm is a bulge in the wall of an artery, and often due to weaknesses in the arterial wall. Again, if this occurs near your ear, it can cause turbulent blood flow, leading to a pulsatile tinnitus. Slightly differently, arteriovenous malformations are abnormal connections between the arteries and the veins, bypassing the capillary system. Again, if this happens, it can cause direct high-pressure blood flow from your arteries to your veins, creating this pulsatile sensation. Another culprit for pulsatile tinnitus is high blood pressure, also known as hypertension, which can result in an increase in blood flow force through your arteries, especially near your ear. And again, this turbulent flow can create a rhythmic sound in sync with your heartbeat, perceived as a thumping or whooshing noise. Now, on top of that, there are also some ear abnormalities that can lead to pulsatile tinnitus, such as superior semicircular canal dehiscence syndrome, which occurs when part of the bone near your semicircular canals in your inner ear is abnormally thin or missing. And believe it or not, in around 1 to 2% of individuals, this bone doesn't mature and thicken properly, and in fact can even become thinner with age. Now, this is often accompanied with sufferers excessively hearing their own voice, their footsteps, and it's even reported that some sufferers can hear their own eye movements. Another cause of pulsatile tinnitus could potentially be a tumor, such as a glomus tumor in your head or neck. These highly vascular tumors compress on nearby blood vessels, disrupting normal blood flow and creating a rhythmic sound, which you may perceive as a pulsatile tinnitus. Glomus jugular tumors, for example, can grow near the jugular vein and into your middle ear, causing this kind of tinnitus, which is sometimes accompanied with a hearing loss too. Now, as well as the conditions that can cause a pulsatile tinnitus, there are also types of rhythmical tinnitus too. For example, myoclonus is a condition which involves the rhythmic contraction of muscles within your middle ear, which can sometimes contract involuntarily. It's a little bit like that strange feeling that you get when your eyelid twitches. We've all experienced that. When these muscles in your middle ear spontaneously contract, it can lead to a rhythmic sound, but doesn't necessarily follow your pulse like a pulsatile tinnitus would. Another pretty rare cause of rhythmic sounds inside your head is something called Patulous Eustachian tube syndrome. Normally, the Eustachian tube, which connects the middle ear to the back of your nose, remains closed and only opens briefly during activities such as swallowing or yawning. However, with Patulous Eustachian tube syndrome, your tube might stay open more often, which allows the sound of breathing and speaking to be transmitted directly to your middle ear, creating this rhythmical tinnitus type sound. So the big question is, if you have this form of pulsatile tinnitus or any form of pulsatile tinnitus, how can you find out the most likely cause? If I come across anybody in clinic that experiences a pulsatile tinnitus, I will immediately refer them for an ENT to look into that cause. Normally, they'll start by taking a detailed medical history and performing a physical examination. And as you can imagine, they will focus on your head, neck, and ears. And believe it or not, they may even attempt to listen to your pulsatile tinnitus themselves using a stethoscope. There are various tests that will help to pinpoint the exact cause of your pulsatile tinnitus, which is crucial for finding the right treatment for you, which can include imaging tests such as an MRI or CT scan that will provide detailed images around your head and neck. And even an ultrasound can be performed to check the blood flow in your neck. So what happens if a pulsatile tinnitus is left untreated or uninvestigated? Now, it's important for me to mention here that more often than not, pulsatile tinnitus is nothing that you need to worry about. But you should definitely head over to your doctor for further investigation so that they can rule out any dangerous causes. In very extreme cases, and I mean very extreme cases, when it's not treated and it's an indication of something more sinister, there is the rare possibility that whatever's causing your tinnitus could also lead to blindness, strokes, and issues with walking or talking, or even a fatality. So, as you can appreciate, this is why I'm recommending having it investigated as soon as possible, so a doctor can determine whether your pulsatile tinnitus is dangerous or not. Assuming that it's nothing sinister, there are also a handful of lifestyle changes that you can personally make to reduce your own tinnitus. And I've outlined them in this video, which you have to watch because it's had over 500,000 views already.